So today we are going to explore sterile fields. We're going to start with the sterile dressing change. Did any of you get to see, didn't you get to see a dressing change at clinical? Did they do it sterile or non-sterile? Was it just clean? Or you're not sure? It's okay.
I think it was non-sterile.
So a lot of our wound change or dressing changes don't necessarily have to be sterile. So when you are at the site, you may see that they're just using clean gloves. Yesterday, we had a doctor that came in and debrided a heel wound, which was what's that? Yeah, we got to see some cool stuff yesterday. That's the beauty of day shift. It's kind of a blessing and a curse, right? Day shift is really, really busy. But we did get to see, the doctor came in on our shift. And so a couple of the students were able to see this debridement of this, what's called Eshar tissue that needed to be pulled off because it was just harboring bacteria and infection underneath that can get to the bone. So with a wound like that, we would approach that in a sterile manner. So what is the definition of sterile? Does anybody know?
Without bacteria.
Yeah, any sort of microbes. Zero microbes is sterile. So are we in a sterile environment right now? No. Are the gloves in a sterile environment? Until when? Until you open them up, right. So we use what's called aseptic technique, which is to minimize the introduction of any microbes into an environment that we want to remain sterile. We do the best we can. You cannot create, even in an OR, it's not a sterile room. Because the second a human being walks in there, unless you have been sterilized, and there are some of those where they have gases and whatnot, that you wear the whole rigmarole, you cannot create a sterile room. Think about our patients' rooms. They're barely even clean.
Yeah.
We're going into those rooms, so we will be making a sterile field using aseptic technique to continue to do this sterile dressing change. The reason why we call it sterile dressing change is that we use sterile gloves, we use sterile supplies, we use aseptic technique, again, making sure that we do everything within our power to not jeopardize that field. So what priorities do we have when we're thinking about wound care? We're going to go in and do a dressing change on a patient who has a tunneling wound. What are some things we want to be cognizant about? Yeah, we want to be looking at it. We want to read the chart note before. We want to know what did that wound look like before, because I want to compare it as I am inspecting it when I'm doing my sterile dressing change. We want to know, how did the patient tolerate it? If the patient was really painful, if they had a hard time last time there was a dressing change, we need to think about that, manage our time, and make sure that that patient's pain is under control before or pre. They might not even be in pain at that time. So to go in and say, what is your pain right now? And they say, oh, it's a 0. But during the dressing change is when the pain is going to happen. So let's pre-medicate, so we already have pain medicine on board before we start the process. Now, some of these patients don't have pain. Why do you think that is with these tunneling wounds? What?
Death of the tissue and nerves.
Yeah, so the wound has gone right through that nerve bed and there aren't any nerves left. The surface area can sometimes be painful, but when you think about like this really great big tunneling wound, you think, oh my gosh, that has to be painful. A lot of times it's not, because the nerves are just gone. But always good to find out. Best practice is to read those notes and pre-medicate your patient before you go in. Also collecting all of your supplies. We talk about clustering care. Once you set up a sterile field, you do not turn your back on it. You do not leave it. You are there. You are tied to your sterile field. So making sure you have everything with you is important. What would happen if you thought you did everything that you could, you're in your sterile field, and now you're stuck and you forgot to get some supplies? What's something you could do?
Hit the call light.
With your elbow.
Yeah.
Or you have a patient right there, right?
Yeah.
Yeah.
Hey, or a resident. Hey, resident, could you hit your nurse button for me? Just have them hit it for you. Get some help in there and continue on. Good. So what are we looking for? You talked about that inspection. Evelyn said swelling. Yeah, we want to look and see what it looks like. What are the kind of the two spectrums that we are inspecting with a wound?
Color.
Okay. What's worst case scenario that's happening with our wound?
Infection.
Infection. Good. What's best case scenario?
Healing.
Healing. Right. So we want to look for signs of infection, which you talked about. Any purulent drainage,
Smell.
the smell. Yes, I will tell you that when Devin and Fatima came back into the room and I asked them to give a little presentation about the patient's wound, the word that Devin used was it was gnarly. And he goes, I could taste it.
Oh.
And that was with an N95 mask on.
Wow.
So those are other things to prepare yourself for, that it can be very smelly. Gangrene is a horrible smell. It's tissue death, right? So if you think about decomposing tissue, you can imagine what that smells like. On top of that, it very well could have been on the coccyx, where what is really close by there that could contaminate that field? Stool. So it can be a very challenging place to heal, and also to prepare yourself for the smells and what you're going to see when you go in. The one thing that COVID, I think, has taught us, and I can't believe, because I used to do dressing changes all the time in long-term care facility when I was an LPN. I did these tunneling every shift, and we never wore masks. We never wore goggles. Ours were not, again, they weren't sterile. It was a facility procedure policy. And so we did them clean. The packing strips were the sterile part, and we were able to wear sterile gloves, but we didn't have like a sterile field that we would set up. But yeah, I think back and I think I can't believe that we didn't wear a mask, because even as you are packing a wound and you're talking to the patient, I just thought it just makes sense. But being a new nurse and the facility, again, I'm not blaming anybody, but it was one of those things that has projected, and also goggles. This patient was very compliant and didn't move around and things weren't splashing, but still, I think that those are good practices to wear all of that PPE, including a gown, because as you're pulling dressings out, I think that would all be appropriate. We're very low on PPE in the world right now. A lot of these long-term care facilities don't have a lot of money, and patients' insurances sometimes also don't pay for the supplies that we think would be best for them. So these are all challenging things that you are going to run into as a nurse. We're going to be talking about ethics and justice and equality of care, and it's challenging, and you're going to see that. So some of the questions that came up in the skills lab sheets, I just wrote down a few of them, so if I don't address it, please let me know, is how often do we do sterile dressing changes or even dressing changes? A lot of times that's just going to depend on the physician's orders. The physician will say twice a day, once a day. They'll talk about if it's damp to dry. They will make recommendations of like a colloid topical dressing, impregnated with antibiotics. They will discuss the type of dressing and the frequency in the orders. That being said, if a patient had a dressing that was soaked with stool and we have just changed the dressing, do you think we would wait for 2 days before we change that? No, good. So as needed, because our goal is to keep that dressing clean, dry, and intact. Those are the things you're going to look for. So if you were helping an aide change a patient's attends, then you saw that it was not clean, dry, and intact, we would want to make sure that we're getting that changed. Another question was, what are the different types of dressings we're learning? We're only learning one type. There are so many different types of dressings. This is also bottom of the level. There are amazing dressings out there now with tegaderms and like the hydrocolloid, the ones that do have sylvadine that are worked into them. It's amazing the amount of technology that's being placed into wound care because it is a big industry. I'm shocked that there aren't more, and I believe we're going to move in that direction, wound care specialists. That's what I wanted to get into when I first got into nursing. But we had one wound care nurse at the hospital. That was it, one.
Which one?
At St. John Hospital in Longview.
Okay.
And I mean, she was busy all the time. And then there are ones that come to the facilities, like the doctor that came and saw the patient yesterday was a wound care. He was focused in wound care as well. But it's not a huge industry right now. It's very narrow. And so trying to find a job and specialize, and I wanted to get out and work. So, but it's an area that if you're interested in, there are certifications. And if you continue with your schooling, I think it would be a fascinating goal to get into. Because I don't know if I've talked to you all about that. I love pus. I think pus is the most amazing thing that the body creates, and I just love it. There was also a question about, do we use iodine when we're cleaning? What do we use to clean out the wound? And typically it's saline, normal saline, sterile, normal saline, or sterile water. Either one is fine, depending on your facility, your policy, your protocol. Both of those are appropriate to clean a wound and what we would use for our damp to dry dressings. Iodine and like peroxide are great for cleaning out debris and getting that initial cleanliness done, but we don't want the chemicals in those or the action like hydrogen peroxide to break up the healthy tissue that is in the healing process. So we can actually do more damage by introducing those as the tissue starts healing. Again, at the very beginning, it's very appropriate, or if you had a wound that did not look good and we needed to really flush it out and clean it out, we would want to make sure that we had some orders for that. And the way that we get those orders is by inspecting our wound, documenting what that looks like, and then making those recommendations of, this does not look like healing tissue, this looks like infected tissue, we need to get in there and get that infection under control beforehand. Or the doctor might give an order for an oral antibiotic, so now it's systemically in the patient. So were there other questions that any of you had that I didn't answer with those? Okay. All right, so I'm going to hand out another checkoff sheet. This is, I have one for sterile fields, one for donning sterile gloves, and then one for the actual dressing change. So this looks like a lot, but it all works together. So this is just to give you a good idea of a step-by-step on what we're doing today. This will be a return demo. So when we start doing return demos in a couple of weeks, you're welcome. You need to ensure that you are ready to go. You can practice this in open lab. So if you are signed up, you can do your head to toe assessment or your sterile dressing change. Okay. The first thing we want to talk about is donning your sterile gloves. I'm gonna have you watch me first and then we'll walk through it together. Technically, putting your sterile gloves on is the last thing you do before you before you do your dressing change. But because if it's a new concept to you, because it's not like just putting on clean gloves. There's a process and procedure to do this to make sure that your gloves stay sterile. So that's why we do it first. We want to practice it a couple of times. These are yours to keep. So you need to take care of these. You will use these over and over again. If you happen to poke a hole in them, obviously we'll give you a new one. But do try to take care. Some of yours are in a wrapper like this and some are not. Yeah, go ahead and hold yours up, Sarette and Evelyn. See how theirs are kind of in half? So they're the same thing. Once we open them up, they look like, yeah, hold yours up, Heather. So it opens up that bad. So go ahead and leave it closed. So I'm gonna show you again first what it looks like, and then we will do it together. All sterile packaging is going to have a little lip at the top. Usually there's glue on the side, so I always recommend popping that so that you have a flush area. Using both of your thumbs, pull apart the glue, and then once we open this up, if this was to go onto a sterile field, first of all, if it did that, we would just throw this out, right? But if it were to go onto a sterile field, you would hold it and then place it onto the sterile field. Because the outside we can touch, we're going to just keep the gloves off of our sterile field and don them outside of our sterile field. Once we open this up, the inside of this packaging is sterile. So you can open this up and you will see that there is a margin that is around. That is the only area that you are going to touch. Okay, so when we open this up, we cannot let anything, once we have exposed, we don't want anything to come back over the top. This is going to want to pop back over the top of, can you see, Kyla? This is going to want to pop back over the top. So what we do is we just move this and just kind of give it a pinch so it stays open. Okay. With the margin, again, we've got the edges that we can touch. This is going to want to flip back closed, so I just kind of give it a little pull and a pinch, so it will lay flat for me. Okay? It doesn't matter if you go right hand or left hand first. You always will don your gloves with the gloves will be in the packaging where you put it on palms up. So I like to start by donning my dominant hand. The cuffs are rolled up in such a way that you can touch this outside. So it's like it's rolled up into a cuff. The cuff part is what's going to be against my skin, so it's not going to be sterile. You want to avoid the tips of the fingers. You also want to be careful that you never go over the top of a sterile field. So as you're donning your gloves, you don't want to be leaning over like this because all of this area is sterile. So even doing this is considered not sterile over the top. You're contaminating your sterile field by reaching over the top, okay? So you want it to be in a good location for you. What's the first thing we do before we do anything? Wash our hands. With sterile field, we want to actually wash our hands. The number one contaminant research shows in a sterile environment is skin cells, those epithelial cells. So we want to wash our hands very well. You also don't want any hand jewelry. If you wear a wedding ring, if it interrupts the integrity of the gloves, if it's going to snag them, you want to remove that as well. Flat rings aren't as, they don't interrupt the integrity of the glove as much. I will tell you that your hands will sweat in these a lot more and it can get irritating underneath the ring. So washing our hands all the way up to our wrists, make sure that we're not wearing any wrist jewelry. And so now I am going to grab by the cuff here, and again, I don't want to be over the top of my other one, so I just kind of step to the side. Make sure that you don't have people running around that are going to run into you as well. And now I'm just going to put my glove on, Making sure that I keep my hand back, because this hand is not sterile and I don't want it to touch any of this. So if I'm doing this, can you see where it will, so I want to make sure that I'm really cognizant of keeping my hand back. And then I'm just going to put my glove on. I want to try to get it up as far as I can, but you can see that that cuff is still there. This is the area from the palm up is where I'm going to be doing most of my touching of all of my sterile field. But I don't want to go back in and pull this down. That is going to contaminate that area. So you kind of get what you get once you put that on. Now this hand is sterile, so I can reach in to this one. But because again, the cuff is going to go against my skin, I want to reach in underneath the cuff, like so. And this is all sterile, so it's okay that it's touching here. And now I'm going to put my other hand in. The thumb, you want to cover, this helps you if you put all 4 fingers, I'm just going to turn this around this way just so you can see. All 4 fingers underneath, because that's going to protect as I put it up onto my non-sterile hand. But the thumb is kind of out there, and if I use this to put over my gloved hand, you can see where I could contaminate pretty easily, right? So I try to keep my thumb up out of the way. So I'll put my hand in. We call that the hitchhiker glove, or the hitchhiker thumb. And I let go. Oh no, look what happened. Do you think I can do that very well? This happens all the time. I'm sterile, right? I'm just gonna come in here and I'm going to put this finger where it belongs. I'm gonna reach from the palm. I do not reach from the glove cuff, so I'm going to reach from here. Again, keeping my other fingers out of the way, and I'm going to put that on. This happens all the time. When your gloves are sterilized by the company, sometimes they actually adhere together because this is a, what's that?
Oh, I was saying yeah.
Yeah. So time, temperature, and pressure is how we sterilize things. So if you think about the material that this is made out, it's a synthetic material and it can adhere to itself. So they can kind of stick together, and when you go to put them on, that it happens on a regular basis. So don't panic. If you're still able to do, it's harder when you do it on your first hand, because then you have to use these fingers to try to get your other glove on. If you can't do it safely, just start over, okay? So now I am sterile. I like to go, make sure that my fingertips are all the way into my gloves. Again, watching how you are doing that, only pulling from the cuffs, okay? You want your gloves to fit really well. You don't want big gaps here at the end because those are going to be floppy and can contaminate. You also don't want it so tight that you can't move your fingers, and then you also lose feeling and dexterity. So that's why I was asking you all about your hand size, and we'll evaluate once you get your gloves on, okay? Once you have your sterile gloves on, you now cannot touch anything that is not sterile itself. Even this paper, even though these just came from here, I'm not gonna take this and throw it away. I'm just gonna leave it there, and I'm gonna go to my sterile field. This is why we also say this is the last thing that you do. So before you don your sterile gloves, you're going to look at your environment and make sure that you have everything that you need, okay? When we take gloves off, I pinch right in the palm and pull, and then wad up and then up and under, and now they're all secure. You will need to reuse these. So once you've pulled these off, you can just pull them out, and if you just kind of fill them up with air a little bit and then just squeeze, the fingers will pop right out. Set yourself up for success when you go to put it back in. Give yourself a nice cuff and make sure that you have the left on the correct side, the left on the left and the right on the right. Again, palm up so that it's a natural way to put your gloves on, okay? Ready to practice?
So we're just saving this one for now for practice, right?
You have to save that, yes, you never ever reuse sterile gloves. But we don't have enough to give you gloves for every single time that you practice in here. So you will set these back up for yourself. Did that answer your question?
Yes, I was just thinking about the actual setting.
Oh yeah, the actual setting, you would never ever reuse a pair of sterile gloves. Okay, so it's probably easier to stand because you're mainly going to be at your patient's bedside. So you would want to make sure that the bedside table is free of books and orange juice and all of the other wonderful things that our patients have on their bedside tables. To make sure you have a good working environment, I always take a sanitizing cloth, wipe that down. We want to do the best that we can. You don't have to do it today, but we want to make sure that we're setting ourselves up for success when putting that together. Okay. So Evelyn and Sarette, yours are still in the sterile packaging, so this will give you a good opportunity to just kind of see what that looks like, to just open those up. You're not needing to do it in a sterile way right now, so just kind of see what that looks like. Put it onto your table. When we're doing a sterile field, think about as you are working, what don't you want hanging down into your field? Hair, necklaces, stethoscopes. You cannot be, you need to get some bobby pins or something.
No, I usually just throw it up here, but.
Go ahead and do that today, because
Okay.
I do not, if you touch your hair during a sterile dressing change, if you're in my, I will say, you're done, you did not pass, you need to go and practice. Because touching your hair, even during a clean procedure, is not a septic technique. You are introducing, first of all, microbes to yourself because you've been doing a dressing change, or then now you have touched your hair and you are, yeah, good, Evelyn, tucking any sort of things that are going to drop. If you have big floppy sleeves, I wouldn't do that either. If you have just sweatshirt sleeves, I would push those up. The surgical unit that we work in have mandated that we wear like the really tighter underarm. I actually had to buy like bicycling sleeves for my OR staff so that their arms were completely covered when we were setting up sterile fields. Here in the long-term care facility, you won't be doing that. Just make sure that you don't have anything that's going to get into your field. Okay, so go ahead and open up your gloves. Go ahead, Kyla. Yeah, do the top and bottom first. Other way, so you'll open it up. Oh, yeah, there you go. And then just kind of pinch it. Or also rip this, this is not to call you out on anything you didn't know. But anytime you have anything wet, because this is paper or your field, water is a conductor, and so that could soak up and underneath. So when you're wiping down your field, make sure it dries before you, that was reminded me to say that, so.
So is
Yes.
this sterile right here?
No, the inside is sterile,
Okay.
so this is where you want to just grab onto this part.
Okay.
Yeah. Okay, and then open up, and then kind of pull it out straight, and there you go, I think you're perfect, okay. So now, depending on what hand you want to do first, which glove you want to put on first, you will reach for the opposite. So you would use your left hand to put, or your right hand to put on your left hand to put on your right hand. Does that make sense? Yeah, and it's always palm up.
So this is right and this is left? Is
Correct.
that- Okay,
And you can see it here too.
Yeah.
Yours came with the right and left.
okay,
So,
okay. So I can,
yep, just on the cuff. Okay. And then,
I feel like this is really hard.
is there a way to like pull that down?
so I just keep pulling. If I have this, I just keep pulling and kind of move my wrist back and forth.
Okay.
For you, for next time, you might wanna just reach up a little bit higher.
Okay.
So you can
So I
still,
could even like,
I would be careful getting up to that
Yeah.
far, but you could pull it from
At
right there
least.
and keeping your, yes.
okay.
So now, are you good? Okay, so then, yeah, just go for it. And if it's easier to like turn your paper around, or, I mean, feel free to do that too. Just make sure that the tips of your gloves are not.
I'm doing right.
Look at how much your face contributions.
There you go. Yeah, that's tough, I agree. Oh, yeah, keep
Yeah,
that
it
thumb
feels
up.
weird, right?
There you
Feels
go.
like you don't have a glove on your face.
I know, I don't like a little, this
Hey,
thing.
Good.
You can't touch it.
You can't touch it, no. So,
Wasn't not so bad.
I know. That is the one good thing about, like, if you are like in an OR setting, cause you have a sterile gown on as well, then you can pull it up over top, but in this situation, you have to leave it where it's at. Okay, so once you, do those feel okay? It's a little bit big, but
Yeah, that's what I was thinking.
it's a 7.5, right?
Is there only like half sizes?
Yeah. It's only whole and half sizes, so we can maybe try a 7 for you. Do you wanna try a 7?
Yeah.
I was wondering if I might try a 7.
Okay.
One of them feels different, one of them feels kind of tight. Maybe I have two different sized hands.
7. Oh.
My ring sizes are different, or,
Like, this one feels
Yeah.
so snug.
Okay.
The same thing. I have dominant hand and
Yeah.
Yours feel tight too.
yeah, my dominant hand is bigger.
Why do you think that is?
It's
Muscles.
stronger, more
Yeah,
blood flow,
you
yeah.
use it more, so your muscles are gonna be
Yeah.
bigger.
Yeah, so maybe we should all try a 7.
I think mine are tight too.
Okay. You don't want them to be too loose. That's the thing, because if they're too
I'll just
loose,
get mine.
So you think mine are look good?
do,
They just feel tight right here.
yeah, and that is really hard. Pull them this way. Pull them off like you would
Okay.
normally. There you go.
Oh, yeah.
And then just turn it back inside out.
We're sweaty.
Yeah, and if they're sweaty, you're going to want to, well, we're gonna throw those away anyway, but, 7.
We could just keep them for extras, could we?
Yeah,
For house cleaning.
Yeah, just in case we need to.
It's
rip
happening.
one, Cause they fit
The
the
fingers.
fingers.
yeah. So there's, yeah, you can try to fix it now, but see, now you just contaminated because you hit there. So
We're gonna
try
try
to
again.
do, oh, I see, okay, and you're gonna keep yours, Evelyn?
Yeah.
Okay,
This is just for practice.
yeah.
We're gonna try again.
So when we do returning demo, if this is what gets picked for us, the gloves are gonna be provided, or do we have to bring our own?
No, I think Kelly said that she provides all fresh for return demos. So you'll practice in lab with these. You'll practice in lab. We'll open up new supplies today for each of you. But then when you're practicing, we'll use the ones that have already been opened.
What?
Yeah, those look like they fit a lot better, Lindsay.
Yeah, how can you tell if they're inside out? These
So
look
some
like
of
both
them
the same.
have writing. So you see how they're writing on here? So it would be, when you cup it, you would be able to read it, so.
These feel a lot better.
What size are you?
7
That
is
one.
This is 6.5.
I kinda like the green of these, cause it makes me think of the Lorax, you know, the Winsler.
We ended up getting green, these are from PCLI, we've used these, because we have this instrument that we have to put into a sterile glove, but it kept getting thrown in the garbage and we'd have to keep replacing them, so I got those bright green ones so that once we put the instrument in there, as they were cleaning up, they'd go, oh, wait, that's not a glove, I'm not throwing it away.
Oh, funny.
Okay. How do you feel?
So how to take it and off of there?
Yeah, so you'll reach with one hand and pull right in the palm. So because, nope.
No.
Because your tip, because this is probably yucky and dirty, you don't wanna touch your own skin.
Oh,
So you'll
right,
take
right.
this hand and pinch right here and pull off. And then you'll
Strong,
wad
I
it,
ripped it.
wad that up.
Oh, like this, like
I'm
this.
just gonna tape this for you.
Triangle,
Yes,
And
and
then-
now,
oh.
your skin on your skin, yep, up and underneath.
Okay, gotcha.
Is that
I'll get you a
Strong
piece of tape.
hand.
Yeah.
And then like that, you throw it in the garbage.
Whoa.
Okay. I will fix it. All right.
Okay.
So, for my right hand,
What if you,
this.
Yes.
so if it's wrapped, you know, like, so you're supposed to, like, drop it onto your kind of sterile environment, right? So does it, like, do you have to be careful about how you drop it, or so like,
Well, you saw that when I did this, it hit and it fell on the floor.
right, so then you have
This
to,
has to be thrown away.
but if you drop it onto, what are you dropping it onto, the bed, I guess?
Yeah, yeah, you could do a bed or another bedside table, or if you had a Mayo stand.
Okay,
And when we go to actually do
I
it,
guess
we can talk about that too.
but it's not sterile, the outside isn't sterile, so it doesn't really matter, as long as you open it up.
In a in an aseptic way, that's
Okay.
correct.
Okay. Okay.
Feel good? Saret?
Yes, we feel better.
Miss Evelyn?
Yes.
How you doing, Kyla? See, that is the challenge with once you go too far.
Yeah, see
So
you
yeah,
later.
just keep your, okay, that's okay though, that's okay. Go down, yep.
Okay.
So now you can still touch there, so just pull that up. That's exactly why I show you
Okay.
that it happens all the time. There. Do those feel better?
Yes.
Good. I know. So just to think when you do put those on,
Oh. All right.
and kind of like what I was saying to Heather,
This was actually like kind of more realistic of what would happen because they were fresh out of the package. And
Yeah.
There wasn't.
right.
Yeah.
And they are a little bit harder. So I guess I do kind of walk my finger up a little bit. Shoot, now I'm gonna show you this again. Sometimes when I just do it fast, because I've done this so many times, it's hard to like slow it down.
Yeah.
Because the cuff will be nice and big. So I grab it from here still, but I do sometimes walk my finger up. I can't do it slow. So pulling it on as I'm pinching, I'll kind of walk my fingers up. And then just keep pulling it and twist your wrist like this, and that will sometimes at least get the cuff down a little bit farther. And so I think it was your second one that you did, Kyla. So I put my fingers in, again, my hitchhiker thumb, and then I'll let go with some of those fingers and then again, twist this around. And I mean, it is pretty strong. Don't pull too hard because you can poke a hole in it, and then once that snaps and it goes back up. But then I just let go of it easily, and then you've got more. But yeah, this is gonna happen almost every time, where you'll want to do this, but you cannot.
I've never even seen that trick where you fill it there and then you squeeze it. I'm always the one that's like poking my fingers through each one.
Yay. So yeah, even with like your gloves at home, like for doing dishes, works really well. Cause you wanna, and you'll see when we're done,
What did I do wrong? Seems like my hand is off.
it's
I turned backwards.
No, it's turned inside out.
Look at
So you didn't put this, again, set yourself up for success, so you need to
there you go.
make sure that your gloves are.
So initially, when we're putting our fingers in, we can use our thumb, right? Just not when we're.
Oh,
Yes, because this is all still sterile and this is sterile, so absolutely you can touch that until you go to put it on, and then you want to pull your thumb back, doing that nice little hitchhiker thumb.
Yeah.
Yeah, this is where then, now
Doing
I
it a
pull
little
I
faster
pull some
helps.
more fingers out as I'm, yeah.
I did that a lot faster.
Making sure that you watch those other fingers, so
Okay.
that helps me get my cuffs
So-
down a little bit
Hold
farther.
it right here,
7 is perfect.
Good.
grab it that way.
Feeling good?
Yeah.
Okay.
Right here, like that. Boom.
So yeah, when you are rewrapping these, just make sure that when you put them in, does this make sense?
Right.
Palm up, thumbs out, with the cuffs up is how you'll package it back together, because that does make a difference, and I don't want you to get confused when you're practicing at home. And then it's the big flaps in, then the top, the bottom, or excuse me, the long way, the top, the bottom, and then in half. Okay?
Good?
Feeling good?
Yes.
All right. I'm gonna move this over here because we're now going to move. And we're going to talk about. Okay. So as soon as you're done there, then come on over to this side.
Different kinds of wounds there.
Yeah.
Poor guy.
So this is Seymour Butts. It's actually his name.
Seymour.
Seymour Butts. We have Seymour Butts over there too. It's like junior, or actually I think that one's senior. That wound is a lot worse.
It looks like something I feel like I've actually seen in the hospital.
Oh yeah. Yeah, I've seen these before
At
too.
least one at a time.
Yeah.
Yeah.
What makes it sore like that?
This
Bed sores? No, it's just.
could be diarrhea. Yep, that has sat
Like a
on
diaper rash.
on the, yeah, like a diaper rash kind of thing. Okay, so we've checked our orders. We see that we have a damp to dry dressing change on Seymour Butts in room 200. So we know that we have an order. We're going to collect our supplies. I want to show you, these are actual instruments from PCLI. I asked one of my friends over there if I could have some of her sterilized instruments so you could see what that looks like. As a nurse, you won't be doing sterilization, more than likely. But I want you to know what sterile instruments look like, because we don't want to run the risk of using non-sterile instruments on a patient in a sterile, in any environment. We want to make sure that they are clean and sterile. So this bag is a kind of a universal way that we use steam sterilization. We wrap this and then it goes through what we call an autoclave, and it sterilizes the instruments that are on the inside. Now, depending on the type of sterilizer that you have, it will have different parameters. With steam, it's typically time, temperature, and pressure. So once it goes through all of its parameters, things will change to tell us that it has gone through its process. So we have what's called autoclave tape. So when this goes on, it looks like just regular masking tape. Once it's been through the sterilizer of time, temperature, and pressure, and it's usually a 6.5 minute long, 270 degrees at 37.6 PSI. As long as that has reached that parameter, this will turn into stripes. That tells us immediately when we look at it, oh, this has been through a process.
Is that's done in like the facility? Like, does the facility has sterilizing?
Yes.
Oh.
Yes.
I just
So-
assumed that they were buying them all the time.
Yeah.
Yeah, that would get really, really
I know.
expensive.
Or like
some
recycling items.
Some are, I mean, it's a good point to say, some of them, like especially like plastic ones, they might come as just a single use.
Mhm.
Of course, single use is going to keep your patient the safest, right? that we're not risking contamination, but it's also super expensive. It's also super wasteful. So that's why you do see reusable, and that we have a sterilization team that will clean. They will, scrub if it needs to have rust removed or whatever it is, that you have a team that has been taught in sterilization to ensure that when you get these, that they are sterile. But I want you to be able to recognize the difference, because if you go to your area to grab those supplies, we want to make sure that somebody didn't just go, oh, and they picked up instruments from the wrong side and they set them in the sterile area. So depending on your facility's policies, with PCLI, the policies that I had set up, or that we would initial, this is the number of the sterilizer, and this was the date that it was done. We say what's on the inside, and then we put the tape on the outside so that we can see immediately, because we have hundreds of these in a drawer when you're looking for them, and when you immediately pull it out, you can tell that it's at least been through a sterilization. We want to make sure that the inside is sterilized. So obviously the outside reached it, but the inside we want to make sure too. So this check mark right here, when we put that strip in before we sterilize it, is blue. The sterilization process, going through time, temperature, and pressure, turns it black. So now I can be sure that the instrument on the inside is sterile. 3M, who did our sterilization, the packages, their manufacturer guidelines say that as long as the packaging is not compromised, there is no expiration date on a sterile bag. The facility that I worked at, just because of how much we're in and out, I said, we're only gonna use these for a year. So once a year was expired, we needed to rewrap these. So just know what your facility's policies are. So we always did a double check on all of our bags. What do you think could compromise the sterility of what's inside this bag?
Puncture.
Puncture, good. If
you drop it,
if I dropped this on the floor, I would definitely go get another one. If I dropped it on the bed, this is all non-sterile out here. It's the inside that's sterile. So you're gonna have to use your best judgment. What about if my table was wet and I laid it right there? Again, water is a conductor, it's a vector. This paper gets wet, it's going to suck that right into the inside, and that's no longer sterile. So yeah, if this was really wrinkled, or if this wasn't flapped down appropriately, those are all have compromised the sterility. So another one of my mottos is, when in doubt, throw it out. So if you look at it and you're like, oh, I don't know, just go get another one and redo it. So I just wanted you to see kind of the difference. This one also has the little boxes right here. These ones are green and red. These ones, this has been sterilized, so these change colors. I can't remember what colors these are beforehand. Probably like a green and a pink, and then once you sterilize them, that they change. So just food for thought as you are setting up a sterile field. Make sure that you know that your instruments are sterile. Since we're wrapping these as we go, the instruments we're using are not going to be sterile. The same will be for anything that has been wrapped. So this is called autoclave paper. So it's doing essentially the same as this. We just don't have a bag this big. Sometimes you will get a whole surgical pack that has like a basin, and then inside it has all of these other instruments and pieces and gauze and things that you are going to need for that. Those are they use a different sterilization process. It goes through the whole different rigmarole, but making sure that you know that this is sterile. Again, usually there's a tape like this that's on the outside that you can see that it has turned. So when you go to get it off the shelf, instead of getting all the way into the patient's room and opening this up and then going, oh, it's not sterile, you have a good indicator on the outside. Okay? Questions about that? Confirm your sterility. We want to make sure that we are bringing everything into the room that we are going to need before we get started. So I have my basin, my scissors, my tweezers. We do cotton tip applicator, an ABD pad, surgical sponge. Actually, this is We want to measure the wound because we talked about that we want to see signs of infection, but we also want to see signs of healing. So this is a nifty little wound measurement, especially for those decubitus ulcers that are round. We're going to use normal saline, and you can use normal saline or sterile water. Make sure it is a sterile. It would say sterile on it. If you are opening a brand new bottle, we want to date, time, and initial. When we do that, 28 days is the typical time that you can use multi-use items, whether medications or the saline. Go ahead.
So if somebody is a daily dressing change, you can use the same bottle of saline like for the next day.
Yes, and your facility might have like single use. If they have single use, I would recommend using those. I think it's a lot safer to do that. This is not my favorite approach. Again, coming from an OR where we only did single use, it's hard for me to do that. But again, bigger bottles are less expensive.
Yeah.
So
I think we use flushes at the hospital, just
yes,
empty flushes.
yeah.
Yeah.
So again, depending on your facility, will depend on what type you're going to use, but you'll just need some sort of sterile, either water or normal saline. And then we have our packing strips. These packing strips are long tape. They're they look kind of like a flat shoelace, and that's what we use for our tunneling wounds. Okay. So we make sure that we have all of our supplies. I grab my gloves. Oh, and you know what? They used up all the tape. I don't know where Kelly has to do that. You might have to fake the tape. Okay. I always like to have a Sharpie to do all of my dating and timing on my patient's dressing. So when you come in and you're going to do a dressing change, there's typically going to be one that's already in place. So this is going to give us a good idea also of the supplies that we need. So reading your wound note, the narrative note, before you come into the room is a great first start. Collect all of your items and come in. Again, we've looked at our order, we've pre-medicated our patient if we need to, or coming in, providing for privacy, washing our hands, and identifying our patient and making sure that this is the patient that we need.
So will the like wound care notes, will they usually say like all the supplies that we would need or be using?
Sometimes, but not always.
I mean, I guess some things are pretty common sense, like, I mean, gloves are obviously common sense, you know.
Or if it says sterile dressing change, damp to dry, this would kind of be your basic set. Some of them will have like a kit together that you could pull. Some, you won't even have some of this stuff, and you kind of have to, as a nurse, just go, what is my best case scenario? Or you need to get on the horn with your supplier and say, I need to get these, or borrow from another facility or another floor or something to make sure that you have the proper equipment and supplies. Okay, this part is not sterile to pull off the dressing. You want to check the time and the date. Make sure that it wasn't 2 weeks ago. If it was, you need to document that. When we're pulling off, this is going to come off really easily. Just know that the tape doesn't stick really well to these mannequins either. But we don't want to just, this is not one of those rip the Band-Aid off like we'll do to ourselves sometimes. The skin is very frail. We want to just ease this off, pull it off. We're going to look at our dressing, see what kind of draining is on here. I'll also bring in like a biohazard bag and just set it on the bed. Obviously, we're not going to have the patient positioned like this. I just want to make sure that you know that I'm just doing this so that you can kind of see. Actually, I could turn it this way so that you guys can see too. Just trying to get that on the video. Okay. As you're pulling the packing out, this will also depend. You might need some non-sterile tweezers to help you get this out. I would just pull the packing out, pull it out carefully. We don't want to pull this out too quickly. And then once you pull out the packing, you can kind of determine how long. So when you said, how do you know what to do? You can kind of look at your supplies. Okay, it looks like I need about that much. That's how much they put in there before. That's not to say that it might not have tunneled farther. So I always go more than what you think that you're going to need. We are saving all of these dressings because we're going to use these in lab. So just
I have a
for
quick
the-
question though. What happens when, like, sometimes the skin will stick to that kind of stuff? I've seen that before. Do you use like the saline to like try and pull it off, or like do you want to grab like the forceps, whatever, and pull on?
So part of the reason why we do damp to dry, do you know why we do damp to dry?
So it heals from the bottom up.
Right, so we don't want this to heal over the top. So we do want some of it to stick because we want that old dying tissue to be pulled off so that it can continue to heal. If we are concerned that it's embedded and we can't get it off, then take a little bit of that saline and you can use, like, a syringe works really well because you can control it a lot better and just soften it up a little bit to pull it off. Yeah, good question.
I have another question. So is this right there, like, there's a smaller tunnel in there? Is that the tunnel, or is the whole thing the tunnel?
This is the tunnel,
Okay.
but then we still need to pack the perimeter of the wound. So we don't want any piece of that to be open because we, again, want to keep it that damp so that's what's going to promote the healing. We don't want it wet because, again, what's the goal?
To heal.
To heal, yes. We want it to dry. We want it to dry because we want that to start to dry, so then we can pull out the dead tissue and keep, it's just kind of like 2 steps back, 1 step, or 2 steps forward, 1 step back, 2 steps forward, 1 step. We're gaining ground, but if it ends up building up and it's not healing, if we don't have the proper steps of our healing in our skin, it's going to negate what we're trying to accomplish, and then you end up with infection underneath that all of that dead tissue. So that's why we pack it that way.
Which one's the tunneling?
You can
Oh.
see.
I think there's actually one on this side too.
Those are the tunneling, the little holes?
Yeah.
Oh, okay.
Oh yeah, there is.
In there.
Oh yeah, there's a couple of them in there. We're only going to do one today, and whoever comes over and works on that one over there, that one's a lot bigger, and so we're just going to do part of it. We won't keep opening up supplies. So just pick one tunnel. Remember your body mechanics. So if it's better for you to raise up the bed, and then also if I was going to do this one, it would probably be easier for me to be on that side of the bed. So when you're undressing the wound and you've read your wound note, know where it's at. I might have to start on this side, and then I might need to move around. You might need to just start a whole new sterile table, so just keep those things in mind as you are looking at your wound beforehand. So I've got this all cleaned out. If there was stool that was up in this wound, what do you think we should do? Yeah. And this is where those syringes come in handy. They have really nice, like 30 cc and 60 cc. So I would get a Chuck's pad, I would get towels, and I would just take my syringe and I would suck that up and then just irrigate. Just keep irrigating so that until it runs clear. Make sure that we're documenting that, and that would be something you would report off to your fellow cohorts as well as in your nursing note, and maybe make a recommendation. Hey, doc, maybe we need to do more of an impregnated antibiotic packing. Sometimes the strips will actually have anti-infective again in them, to where we're still using the strips, but we're not like squirting, for lack of a better word, Neosporin or something into the wound. So it's amazing the different types of products that are out there. Silvadene is another thing, like silver is a wonderful natural anti-infective, and so you'll see dressings that have that, again, infused or impregnated into the wound, into the dressing itself. Okay, so we've got it all unpacked. We've irrigated. What do you think is another thing we want to do?
Measure.
I was just gonna do it.
Yeah.
Did you see me reaching for it?
Yeah.
I was like,
I'm
oh,
like,
I gave it
measure
away.
it.
I gave it away. Yeah, it's funny when you just kind of get on a roll sometimes. So yeah, these are nice little wound measure Medi-Rule. Some of your sites will have this. If you have a wound care kit, sometimes when you open that up, this will actually be part of it. So just lay it over top and measure. You might have to use the ruler because with this, it's not exactly round. So just measure and document your measurements.
And that's not sterile, right?
No.
So we would use it before we do our sterile part.
Correct.
Okay.
Yep, this will just be on the surface. I would make sure that it's clean before, and then this just gets thrown away. This is what is handy about having like a bag on the bed or nearby that you can just toss these things into. Or a trash can, if you have a trash can nearby. Okay, so now I'm ready to do my sterile. So I'm gonna go over, I'm gonna wash my hands, again, making sure that I've washed all the way up to my wrists. I've got all of my supplies. So our goal is to get everything set up before I put on my sterile gloves. When you have a sterile pack, we always open away from us first. We want to avoid reaching over a sterile field. Making sure that people know that this is your sterile field and you own this. So if you were to come in and start talking to me, I'd say, can you please step back? Does anybody know the distance you should remain from a sterile field if you're not sterile or
I'm
not
gonna
working
guess
in it?
6 feet.
It's 12 inches.
Oh, okay.
Because there are like in the OR, if a circulator needed something, I need to be able to get it to them.
Yeah.
So yeah, 12 inches. But be very emphatic when you're around a sterile field. You know, I always say I'm a little more fluffy. And so sometimes when I'm in the OR and I have to go by, I'm like, okay, I'm aware, so that people aren't questioning your approach. So whenever we're opening up a pack, we open away from us first, because now all of this is still over the top of my sterile area. I also, before I even open this up, I want to kind of guesstimate, where do I want this to end up? Because I could switch my desk around, but if I had a stable piece like that and I have this over here and yet I'm working here, do you see how that's not a great? So think about how you want your sterile field to look when you open it up. We're going to open away from us first. There will be flaps to where you can pull this apart. And then also remember that there's a perimeter, like that 2-inch perimeter. But if your sterilization tech has put this together properly, you're going to have a tab right here. Because if this was like this, do you think that would be very safe for me to even try to do this, to try to get that flipped down? So it should be set up for success that you have a flap like that, you can reach in and pull this. Once this goes down below the waist level, because waist level is where we work. We don't drop our hands, because can I see my hands right now? No. We always keep our hands above our waist, and your sterile field is above your waist. So depending on how you're going to set this up, if this comes out and falls down, that's there. You can't now move this here. That's now not sterile. So wherever you let that drop is where that belongs. Keep in mind that you need to add things to your sterile field. So if you need more space, then maybe you open your sterile field in such a way that you have more real estate, or you see what I mean? Okay, bless you.
Zoom tight.
So now I'm going to drop my sterile items onto the tray. Actually, I'm going to tell you one thing that I like to do if I am doing sterile water. I'm going to do this first, because it also reduces the amount of times that I have to reach over anything that is sterile. Obviously, we have to get this in there. Can I do that from 12 inches? No. So I know that I'm not going to work from this area, so I like to approach at the least area that I'm going to be using. When we open our sterile water, again, date, time, initials, and then just pour with your hand over the label so that when it does drip, because it inevitably will drip, it's not going to run that date, okay? If it's a multi-use and it is a second time, I like to just give it a quick little lip, so that if there was anything sitting on the lip of it, I'm just gonna kind of let the water push that away. So now I'm going to come in and I'm keeping, it's nice when you have a bigger bottle and it covers, but you can also see where it is nice if you have those nice long sleeves that are going to protect, but I'm not going to be working in this area, so that's why I approach from this way as well. So I'm just going to pour enough in there. These are water resistant, so it's okay if you drip on there. That's still sterile because what's inside this bottle is sterile, and I just put it into a sterile area. You don't want to do way from up here to where it's splashing out. You also don't want to get too close like this, because if this touches that, then it's not sterile. So, okay. And then I like to just, I'm done with this, so I'm going to get it out of my way.
Is there a reason that you turn when you pour it? Does that help?
Here, when I pour it, I'm lipping it so it goes along that whole lip. I guess that's just a natural, I just do it automatically.
Okay.
So now I'm going to get the rest of my sterile supplies on. Your sterile bags also have a little bit of glue in the corners right here. This just again helps to where if it were open that it wouldn't get caught on things. So I think it's just a design piece. So I always hit the glue areas first, because if you try to open the bag up with the glue there, see how that folds in like that, and then sometimes it'll just rip right down the middle of the paper. Sometimes it still does, but this reduces the risk of that. So I break those. I'm going to stay away from my sterile field while I'm opening this up, because if I'm over here opening this up, that's just contaminating my field more. So thumbs on either side, so I have a nice control of that. I'm going to peel open. Again, keeping, so I don't want to dump it this way because now my fingers are not covered, right? So I'm going to do the best I can to put this bag in between my sterile field and myself, and then I'm just going to let that slide on. You want to be careful of doing something like this so that you're not touching. This is not sterile, this is sterile. So just kind of a nice, easy. Why else would we want to be easy when we're dropping? There's two reasons mainly why you want to be easy when you're dropping it on the field.
You don't want it to fall off.
You don't want it to fall off.
Rip
Actually,
through the
then there's
paper.
three. What?
Rip through the paper.
You don't want to rip through your sterile dressing, and you also don't want to damage your instruments. We have, at PCLI, these are very, very tiny instruments and can bend really easily. So here, these ones are a little more hefty, so they're okay. All right, so now I want this could be a 4x4 gauze. This says it's a surgical sponge. Again, using my thumbs, I'm gonna open up, break the glue first. You can just either put it directly in there or on your tray, either way. This is the pad that goes on the top. So does this need to be sterile?
Yes.
No, it doesn't. We're not putting it inside there. But just for practice, go ahead and just, it's a good practice to just kind of open up. And being careful with your thumb, because I see this sometimes too, where it can slide out. So just be watching and then just slide it onto your pad. The cotton tipped applicators are very challenging because they are tiny, they roll. So, and watch your thumb, because that can also touch right there. You can see how easy that can be. So sometimes I'll just bend it up like this. See how they like to roll? Those are super fun. Okay, so now I've got all of my sterile supplies on there. The last thing I'm going to do is open up my packing strips. I like to save this till the very end, even though I lipped that. The more that this is open, because the inside of this is sterile, the longer or the more susceptibility it has to having contaminants put in, especially if like you're splashing water or things like that. So I save this till last. Because this bottle is not sterile, I can't put it onto that tray. This is a huge bottle of packing, so we want to use this for other patients. Some places you might be able to get one that's just like the whole bottle, but if you're using it again, then this is a multi-use. So I'm just going to set this outside my sterile field, and the lid is open and up. When it gets down to the bottom, it's hard sometimes to fish that out. Okay, so now I'm gonna mentally go through. Do I have everything I need to pack my wound? Okay, I think so. So this is where you can use the side of the bed or another place to don your gloves. It becomes a little more difficult because again, you want to try not to lean over the top of your gloves. Cuff. Fingers. Hitchhiker. Okay, and now I'm sterile. Now I can't touch anything. So yeah, if I was like, oh my gosh, I forgot my cotton tipped applicators. Hey, Seymour, hit your button. Get Kyla in here. Kyla, I need this. Go get it. We also don't want to turn like this because can I tell what's happening to my sterile field right now? We never turn our back on our sterile field. If you need to move, and this is why I like using bedside tables, use your feet. You can touch the center of your, I'm just better with my feet. This is just how I've always used it, okay? So now we are ready to, somebody need to come in?
No.
You guys all
it's
keep
just
looking.
Linson.
Ann's in there.
Oh, okay.
Just watching.
Oh, I see. Okay, so now I want to get my supplies organized. I like to separate these ahead of time because I feel like when it's wet, it's harder to open up. So I'm just going to place these down in my water. Okay. Most of these scissors are right-handed scissors, so you'll want the scissors in your right hand even if you are left-handed, because we learned this in the last class. If you try to use your left hand with right-handed scissors, it will not cut. But it brought up a good point that if that is happening and you are unable to manipulate, you might need to call someone in and say, hey, I need you to cut this for me. You hold on to this like this, and you hand this to someone else, and then they will cut it. Now these are not sterile and they're off your tray. Does that make sense?
Mm-hmm.
Okay. So I have a hard time pulling up things with my tweezers with my left hand, but I'm going to give it a shot. You also could reach in, pull it up, hold, and switch. Just know that if it drops and it ends up on the side, so your risk versus benefit is what you'll do, especially if you're not doing this all the time, it's not super comfortable. So I can't touch any of this because again, everything is sterile. So I'm going to look down into my bottle, making sure that I keep my fingers back. I can't exactly tell. Everything that's inside the bottle is sterile.
So you can touch the rim.
The inside of the
inside.
bottle,
Okay.
just not the outside. And sometimes you get what you get, and you try to find the top, oh, I found it, so that you're not pulling out like a whole bunch of, and if you need to readjust, then, okay. Ooh, so I'm barely hanging on, so I'm, oh. There, now I got a better hold of it. Okay, so I'm gonna pull out my strip and I'm going to cut close down so that it does bounce back into the bottle instead of going back out, okay? So far everything's still sterile, agree? Yes. That is one thing that if somebody is with you or if somebody says, oh, you contaminated, your only answer is what?
Okay.
Okay, thank you. I'm getting rid of it. It's our natural tendency, and I get it because I do the same thing. It's like, I did?
Yeah.
No, it's like, okay, thank you. And just start over. Because there are times where you are so laser focused on what you're doing or that your fingertips, you don't have good feeling in it. Like you contaminate, okay, thank you, I need a new glove. Or thank you, we're gonna start over. So, okay. Depending on, again, your dexterity. If this is a little tiny piece of gauze, I have a hard time holding this close in. So I will use my tweezers. We want to be careful about using sharp things around our patients. That's why these also are plastic. You can use these, but it is kind of nice to just use your hands. So you want to squeeze this out. You don't want this to be dripping wet, okay? So then I take this and I just kind of roll it up in my hand. So I'm turn this way. And then I leave enough hanging down so I can make sure that I'm going to be able to get this into my patient. I like to dip this also to get this a little bit moist, because the dry can sometimes get caught in the fibers, and so then you're like pulling it back out. Doesn't always work, but it's just a little tidbit. So now I'm going to keep my fingers back away from my patient because I don't want to contaminate my fingers on their skin. So I like to feed with my thumb like this and use my cotton tipped applicator to push in. So yeah, if you want to come around the other side. Actually, Lindsay, would you
I was
just
about to
pick
say,
up
do you
my,
want me to hold
yeah,
this?
can you just shine it down?
Can you see it?
Okay. Do you see her hair in my sterile field? You
So-
can, no, it's okay.
Can
you
I
can
flip
flip
it?
it around, I think.
I think I'd have to unpause it.
Okay, so just stand, or just stand right there at the foot of the bed. And then just, you can just shine it, just hold it like right there, perfect. Just
Can
like
you see
that.
it?
Yeah, I can see it. Can you see?
Yeah.
Okay, so that's perfect. So I'm just gonna can you get in here, Heather? Or
Is
just,
that all right?
yeah, you can be right next to me. For learning purposes only, because you're too close to my sterile field. Okay, so I'm going to keep my fingers back. This little guy wants to sometimes rest, so be careful. Whatever you need to do, if you need to flip this around to where your fingers are up instead of down, do what you need to do to make sure that you're not going to contaminate. So now I'm just going to take this and I'm going to feed it into the tunnel. Let's see how it likes to stick. Yeah, and it can be painful to the patient, and so that's where we say, okay, gosh, this is really,
That's why we pre-medicate.
yes, that's why we pre-medicate. Okay, you don't want to jam it down in there, but you want it to be nice and, so this one actually doesn't tunnel too far. So then if we have a tail, just leave it out, but which way do we want to go? If I leave the tail out, do I want to go out this way or in this way?
In, right?
In, yes. We don't want this to lay on the skin, so this can just become part of the packing.
And then it's like easier to pull it out.
Yeah,
too.
you always want to leave a tail so that you do have something to pull out. So when I would go and document this, if I was the first one, I would just say that there's quite a long tail, or that you don't need as much because the tunneling has healed up. So now I'm going to grab my gauze pads. I'm going to wring these out because again, we don't want those too wet. And then I'm going to kind of do the same thing with these. I'm going to separate these out.
I have a question.
Yes.
So you wouldn't cut off the extra tail or anything?
No, because it's
Okay.
just one more opportunity to make a
Contaminate, yeah.
contamination. Yep. So I'm just going to kind of wad these up into my hands like this. Get myself a little tail out. And I'm going to do the same thing, going up and around the ridges, the edges first. Come on. Okay, I'm going to get rid of this one. I'm going to try this one dry. I want to get good control.
Would you be able to do it with your finger?
Well, if I know that I'm not going to need to get back into my sterile field, I could use my
Oh,
finger.
okay.
But
So
if,
at the end,
what's that?
like more toward the end.
Yeah,
use your
I would just be careful to not use my finger until the end.
Okay.
And this happens where it does not want to cooperate. So you just gotta keep kind of poking and poking. So this one looks like it could have used one more. We're not going to open one more. but we want all of the surface covered. So we would, you know,
Would
I'd be
you
like,
use
Surette.
the old ones? Would you
No. Nope, you never use the old ones because that all has contamination on it. So I would say, Surette, can you go grab me another sterile gauze? And then this is when you would be a non-sterile person, you would be setting up so you could put that onto my field so I wouldn't have to get new gloves. So then I would get the next one and I would put it in there and make sure that it was totally covered. Okay? All right, so now all of my sterile pieces are done. So I'm going to, again, we don't drop our hands below our waist. I'm just gonna drop that into the trash. And now I'm going to put my ABD pad on. The blue side up, this is the absorbent side. So I'm going to place that on my patient. And then I'm going to tape it down. We do that in what's called a window. So all the way around the outside. Where do you think we should start taping?
The edges? Or like this?
This way?
Yeah.
So if I tape this down like this and I go to do this,
You're just gonna tape
Start in the crease.
start in the crease, yep. It's natural, that's an answer that we get all the time, but just think about that if this was taped like this and then the patient was moving and now it's going to pull, the tape is going to pull there. The other thing is that we don't want a gap right here because we're so close to the rectum and we don't want that, we want to decrease the chances of contamination as much as possible. So I'm going to tuck that down in there and put my tape on. We want to make sure that there aren't any wrinkles, that we're not taping down wrinkles around. Get it taped all the way around the outside. Then we take a piece of tape and put our initials, date and time. We always use military time when we're dating anything in healthcare. So we'll put that on the corner. We never ever write on a patient, so you're going to write it on the table and then rip it off and stick it onto the dressing. We also don't need to write smiley faces and things like that on our dressings. Just the date and time, and it doesn't have to be like all the way over the bottom.
So at this point, we're no longer
We're sterile.
So
Yep,
we
as
can
soon
just-
as we have that covered up,
Okay.
as soon as we place that over, actually as soon as we're done packing, you could
So we don't have to
use
worry
it.
about like touching the tape and.
Right.
Okay.
And you don't have to change your gloves. These are gloves are gloves are gloves.
Mhm.
Once you get to, so you don't have to take these off and then put on a pair of exam gloves. These have now just become your exam gloves. Okay? So then you put that, and then we go and document everything that you saw. Depending on your policy, you might list the equipment that you used. But I would make sure that you say if it was sterile versus clean. So sterile dressing change completed 10:28,
I don't know
10:28,
I don't know what the date is.
28 at 11:25. You know, talk about the size, how long the tunnel was, and how the patient tolerated it. Okay? Questions? Okay. All right, go ahead and just stop it.